Hey guys, welcome back to our channel. Today we have a really important topic to discuss, and that's Medicare. In this video, I'm going to explain what Medicare is and what it's not. I'll break down its different parts, and we're going to explore options that you have for additional coverage of your Medicare. But first, let me introduce myself. My name's Kelly Adams. I'm a certified senior advisor and the owner of Beyond Home Care, where we provide professional solutions for aging adults and their family caregivers. Navigating the journey of aging can be really stressful and overwhelming. So it's my goal to help guide you through this process by providing resources, tools, and support along the way. Now, let's get started. First off, what is Medicare? Medicare is a health insurance program in the United States that helps eligible individuals with their medical expenses. Primarily, we're talking about people who are 65 and older, but sometimes younger individuals with certain disabilities can qualify. But what Medicare is not is aging insurance. Let me explain. As you age, you're going to have some health-related issues that would be covered under Medicare or your medical insurance. But just getting older and not being able to do some of the same things that you did before, that's not a medical issue. I can't tell you how many times I meet with a family and I'm talking to that aging adult and they're planning to use their medical insurance, their Medicare, to go live in an assisted living or a nursing home, or even to have an agency like Beyond Home Care come into their home and help with getting a shower, dressing in the morning, or even preparing some meals. We would love to help you with these tasks, and we often do. But Medicare does not cover our services, nor do they cover assisted livings or nursing homes. There are policies that cover this, and we call those long-term care insurance. We can go over these type of policies, what they cover, and how much they cost in another episode. But for now, what I want you to understand is that Medicare is not going to take care of you as you age, unless it's a health-related issue. What tends to be the most confusing for people is that Medicare has several parts, and each one covers a different aspect of your healthcare. So I want to break down these parts of Medicare, go over them one by one. So first, let's talk about Medicare Part A. This is also known as hospital insurance. It's going to cover inpatient hospital care. When we say inpatient, that's when you are admitted into the hospital. It's also going to cover some skilled nursing facilities like nursing homes, okay? But in the short term, it'll cover hospice care and even some home health care. Most people don't pay a premium for Part A because either they or their spouse paid Medicare taxes while they were working. Now, Medicare Part B, or medical insurance, helps cover medical services and supplies. Things like doctor's visits, what we call outpatient care. So you're not in the hospital, you're getting preventative services in your doctor's office. And even some medical equipment. Part B requires a monthly premium, which is typically deducted from your Social Security benefits. Now, Medicare Part C, you may also hear called Medicare Advantage. It's an alternative to original or traditional Medicare, Parts A and B. This is offered by private insurance companies and approved by Medicare. These plans, in theory, provide the same coverage as Parts A and B, and will sometimes include additional benefits like prescription drug coverage, vision, dental, and hearing services. Medicare Advantage plans usually have their own premiums and deductibles and copayments. You can think of Part C or Advantage plans as the gatekeeper or that middleman between your physician and your insurance company. We'll kind of go into this a little bit later and what you need to look for. For right now, understand anytime you choose an alternative to a traditional or an original Medicare, it needs to be done with extreme caution to ensure that your current providers are actually in network. Moving on, Medicare Part D, or prescription drug coverage, is an option to add to original Medicare or even Medicare Advantage plans. Part D helps you to pay for prescription medications and is offered through private insurance companies. Monthly premiums and medication costs vary depending on the plan you choose. Medicare prescription drug plans, or PDPs, are standalone. You can enroll in it if you have original Medicare and need prescription drug coverage. You don't necessarily have to. These plans, though, they help you pay for the prescription medications that you may need. So there you have it. These are your basic ABCs of Medicare. Remember, Part A is your hospital or your inpatient insurance. Part B is your medical or your outpatient preventative care. Part C is that advantage or the alternative to traditional Medicare, A and B. And then Part D is your drug coverage. Now, to complicate things a little further, there are some additional options to consider. Medigap, also known as a Medicare supplement insurance, is also sold by private insurance companies, similar to Medicare Advantage. Medigap plans help cover the gaps in original Medicare, like deductibles or co-payments. These plans work alongside your original Medicare and can provide more predictable costs. Medigap or supplemental is not the same as Medicare Advantage, even though a lot of times people confuse those. Remember, your Medicare Advantage or Part C takes the place of traditional Medicare A and B, whereas your Medigap goes alongside your traditional Medicare A and B, and it fills in the gaps or it supplements the payments to help you control the costs. Some insurance companies even offer supplemental plans that go beyond what original Medicare does. Things like dental, vision, hearing, and even wellness programs. I know it can get confusing. So to make an informed decision about your Medicare coverage, it's really essential to review your healthcare needs and compare the costs and coverage of different options. You can find more information on the official Medicare website, www.medicare.gov, or by speaking with a Medicare representative. I hope this video provided you with maybe a little more clear understanding of Medicare and its different parts. Remember, Medicare can ensure that you or your aging loved one has access to healthcare services they need as they age. We'll continue this series in our next video, talking a little bit more about Medicare and comparing it to Medicaid. Many people don't realize the importance of these two programs and even how they work together, and they're not just for low income. So we're going to explore those in our next video and why it's so important to understand these programs. If you found this video helpful, don't forget to give us a thumbs up and subscribe to our channel so that you never miss an episode and get even more simplified explanations on various aging related topics and caregiving. Thanks so much for watching, and I'll see you in that next video.